Erythema multiforme generally consists of a skin reaction, usually due to an infection, medication, or other triggers. It presents with distinctive target-like or bull's-eye-shaped lesions on the skin. These lesions often start as red or pink spots that can evolve into rings with a darker center and are often symmetrically distributed, particularly on the hands, feet, face, and mucous membranes, like mouth and eyes. Erythema multiforme affects less than 1% of the population. It is most common in young adults, aged 20 to 40 years, with a modest predominance in males. There is no association with race. Erythema multiforme has two main types. The first and the mild form is erythema multiforme minor. It is often associated with infections, especially herpes simplex virus or HSV. In this form, skin lesions are usually the main symptom, and mucous membrane involvement is limited or absent, like what is happening in the mouth. And the more severe form is erythema multiforme major. It is often involving widespread skin lesions as well as mucous membranes, such as in the mouth, eyes, and genital area. This form may be associated with medications like antibiotics or anticonvulsants and infections. The most common cause of erythema multiforme is infections, especially and commonly caused by viral infections like herpes simplex virus or HSV. The second common cause is medications like some certain medications like sulfa drugs, antibiotics, antiepileptics, and NSAIDs. There are some other factors like vaccines, cancers, and autoimmune disorders in rare cases. In many cases, inciting factor remains unknown forever. Now let's see what's the common symptoms of the disease. The first and common symptom of this disease is target-shaped lesions. That is what we see as red rings with a central spot. Sometimes blisters or sores in severe cases can be seen. Sometimes itching or discomfort can happen, and it's important to note that lesions are typically distributed symmetrically. Those symptoms that affect the skin usually go away after 2 to 4 weeks. Other less common symptoms include headache, feeling tired, fever, joint pain, and sometimes even eye sensitivity can happen. Depending on where a rash forms on the body, you could have additional symptoms like pain when urinating or pain when eating or drinking. Erythema multiforme is typically self-limiting, especially the minor form, and often resolve without any treatment. However, more severe cases, particularly the major form, may require medical intervention to manage symptoms and prevent complications. Now let's discuss the treatment. The treatment of erythema multiforme primarily depends on the severity of the condition and the underlying cause. In most cases, especially for the minor form, treatment is supportive, focusing on relieving symptoms and addressing the underlying trigger, such as an infection or stopping the causative medication. For mild cases, as we said, we are gonna relieve the symptoms, and the first medication that we are gonna use is topical corticosteroids to reduce inflammation and itching on affected areas. The second class medication are oral antihistamines to help with itching and discomfort. Non-steroidal anti-inflammatory drugs or NSAID like ibuprofen or acetaminophen for pain management can be used. Proper hydration is necessary and vital, especially if there are oral or mucous membrane lesions. And finally, if herpes simplex virus or HSV is the trigger, antiviral medications like acyclovir, valacyclovir, or famciclovir can be prescribed to shorten the duration of an outbreak or to prevent recurrence. For severe cases or erythema multiforme the major, the first thing we're gonna do is hospitalization. It is necessary if there is extensive involvement of the skin and mucous membranes, particularly if there is difficulty eating or drinking due to oral lesions. In some cases, oral or intravenous corticosteroid may be used to reduce inflammation, though their benefit is debated. If a bacterial infection is present, antibiotics may be prescribed. Antiviral therapy is typically given for HSV-related disease. In cases where the mucous membranes of the mouth are affected, Anesthetic or antiseptic mouthwashes may help reduce pain and prevent secondary infection. And finally, for patients unable to maintain hydration due to oral involvement, we are gonna prescribe IV fluids. If erythema multiforme is caused by medication, we are gonna discontinue the offending drug to avoid further progression or recurrence. Consultation with a healthcare provider is important to identify the specific trigger.